Hey everybody, Brian Boyle here, and welcome to episode 157 of The Mesh Tongue. Thanks for joining me, and hey, please, if you've got questions or comments, you can send those to me at Brian, B-R-I-A-N, at company5k.com, and that's the number 5, so number 5k.com, like the race. I'll be happy to get them back to you. Now, some of you may have been watching these episodes, and we're 157 episodes in, and I don't always describe what I do and who I am. So I am a licensed doctor of physical therapy. I've been practicing for almost 19 years, and it's been a wild ride. It's hard to believe it's been 19 years in a few weeks. It'll be a long time, long journey. But yes, and I've been running since the age of 14. I'll be 42 this year, so it's almost 28 years of running and running experience. So I bring this practical knowledge to you so that you don't have to go through the same things that I have either seen thousands of others go through the clients that I've worked with, or even myself through my own personal experiences, that I can help provide you a kind of a shortcut, if you will, so that you can advance well beyond. You don't need to take the 10, 20, almost 30 years to get to that point. We can give you the shortcuts and help you get to that information there. So, by all means, use me as a resource. These videos are on YouTube. I do post them on other sources, so if you're seeing them on Facebook or on Instagram, be aware that they are on YouTube. They're all up there, and you can have access to them for free. Yeah, for free. That's it. My paying forward here, it has been offered in 20 years, millions of dollars that I've made in physical therapy. So this is my opportunity to pay it forward to you. So, without further ado, what we'll talk about today is wound care. Anybody ever have any wounds? I know I have. And how do you care for those wounds? So there's a couple different things. So if you're out on a trail run, and and you're some of the folks that are doing ultras and such, if you're out and about and you're going for 50, 100 milers, or 50K, whatever it may be, quite oftentimes you're going to want to have a first aid kit with you. You may have a laceration or a scrape. Maybe you don't take care of it just then, but maybe when you get done with your race, you need to take care of it. The best thing with a wound is, if you remember this adage, a wet wound is a healing wound. So what does that mean? So you don't want the wound to dry out, right? If you have a wound that dries out, the downside of it is that it doesn't actually heal from the inside out kind of deal, which is what you want to have. You want to have a nice wound base, so you want to keep that wound moist. You don't necessarily want it to scab over per se. You can allow that wound to stay moist. You can keep it covered with all sorts of things. I mean, there's Tegaderm, which is a clear bandage. You can take regular bandages that just kind of band-aids. You can use gauze. You can use all sorts of things. If you have a puncture wound, you want to make sure that that's cleaned out. Now, a lot of people will use hydrogen peroxide. Remember, hydrogen peroxide is a very abrasive agent. It doesn't seem like much because you can get it over the counter. But for wounds, unless there's clearly some sort of sign of infection or something like that, you may not need to use it for all scrapes and cuts. Okay, it is pretty abrasive. Most people aren't going to have an issue with it, but there are some that may have an issue with it. So I'll point that out. Be cautious. It's not to scare you. It's just to make you aware that hydrogen peroxide is seemingly innocuous, where it doesn't have any harmful effects because of the fact that it's a bubbling agent that comes in the drugstore. I can get it at any drugstore, any place that has a pharmacy. It is a pretty abrasive agent. So sometimes this is where the antibiotic, antibacterial creams can do a better job. They're a little less abrasive. So putting that on first, applying it, whether it's on the bottom of the foot or on the shin, the knee. If you've fallen on a trail run, or if you've fallen outside, depending on the time of the year, it could be slippery, whatever it may be. You may fall. A lot of folks running at night seem to have slips and trips and falls and such. So typically the spots, the inside hand, the elbow, the knee, the shin, those are places that usually get red and raw and pretty nasty. And so again, you may get something, you may step on something, and get a puncture wound in the bottom of the foot. that is certainly possible, and certainly does happen. So again, you would care for that. Typically when we have something on the bottom of the foot, what I found that has worked really well is to apply some sort of smaller bandage, and then you can actually apply KT tape or kinesio tape. Keep saying KT tape if you've seen some of the episodes. I'm promoting KT tape, but the kinesio tape, you can apply that on the bottom of the foot. Seems to last pretty well. We've had some pretty good success with the clients that we've used that on, to try and keep things like corn pads and blister pads, even bandages on while running. You could always use a pre-wrap, a foam pre-wrap, and then kind of tape around the foot if you needed to. But sometimes just having less is more. You ever heard that? Less is most, less is more, sort of thing. That if you can get away with putting less bandage, less orthotic, less posting, less whatever in the shoe, you're going to be much better off. So that's where we don't want to necessarily have something on the top of the foot and the side of the foot, and rubbing in the shoe box or the toe box of the shoe. So. What else is there with wound care? So the antibacterial cream, we talked about that. We talked about the bandages. They do make all sorts of different bandages. Some of the bandages now that are out there have antibacterial stuff in them. So again, you can look for those if you know that you're going to be out and about, and possibly on the trail run. Looking for something that you can apply into the inside pocket of your shorts. Or into a kind of a hip bag that may have some water and stuff like that. That may be a perfect spot as well. And then obviously make sure that you get it cleaned up as quick as possible. Sometimes just even soap and water is way better than not applying anything at all. What you're looking for signs of infection is a redness. Okay, and what we call a spider veining can occur, where the blood vessel actually gets infected. And then you have this infection in the bloodstream, and it literally follows the veins, so it looks like this redness coming up. If it was in the arm or the leg, you would look for that. Fever would be another sign that you've got some sort of infection, but usually kind of swollen, hot, red. Fever would be like a last sort of thing, that more internal infection. But certainly those are signs that you'd want to watch out for if you did have any wounds. And obviously a lot of the races now do have first aid tents, so by all means, if you've got any questions, feel free to get in to the first aid tents. Make sure that the medical staff is aware that maybe you got a puncture, maybe you just got a scrape, and you can always ask them for assistance as well. So hopefully find some value in this. I appreciate you being here again. This is episode 157 of The Mesh Tongue. Check out runpainless.com. Also, company5k.com. We've got some information coming up on the Wasatch Mile, September 14th, so really excited about this, and the Company Cup 5K. Company Cup 5K was the original race, and then the Wasatch Mile was added, and so we've got it listed on Bring Back the Mile. So if you look at some of the big names, the Etna Falmouth Mile, the GNC Live Well up in Pittsburgh, we've got the Wasatch Mile in downtown Salt Lake, September 14th, starting off at 5 o'clock. Our elite guys and gals are going to be running off about 6:40-ish. We had a guy that did a time trial last year, ran a 4:05 on a Friday by himself on this race course. It is the fastest mile in Utah, without a doubt. Okay, you're at 5,000 foot elevation, but this is it, folks. Fastest mile in Utah. So if you haven't come out to the race, I implore you, come out to the race. Be happy to meet up with you. Happy to have you come on out. We'd love to have you come on out. And if there's anything I can do for you, again, send those questions, comments to me, Brian, BRIAN, at company, the number 5k.com. And until next time, we'll see you then. But please, whatever you do, don't go hurting yourself to come back. Just share this with your friends, your family, your training partners. Until then, we'll see you.